Hey everyone, welcome back to StrideSmart Run. I'm Dr. Jeffrey Bruening. I'm a sports podiatrist, and I spend my days helping runners stay on their feet and out of my exam room. If you're a runner, there's a good chance you felt it. That sharp stabbing pain in your heel with the very first step out of bed in the morning. That's the calling card of plantar fasciitis, and it's the single most common cause of heel pain I see in runners. Here's the good news. The vast majority of cases get better without surgery, if you understand what's actually going on and treat it the right way. So in this video, I'm going to walk you through exactly what plantar fasciitis is, why your foot type, whether you overpronate, supinate, or land somewhere in between, plays a huge role in what you can start doing at home today, and when it's time to step up to treatments like custom orthotics, shockwave therapy, or PRP. Let's get into it. Welcome to StrideSmart Run. I'm Dr. Jeffrey Bruening, sports podiatrist and a diplomate of the American Board of Foot and Ankle Surgery. Today we're covering plantar fasciitis in runners, what it is, why foot type matters, what you can do at home, and the clinical treatments when self-care isn't enough. The plantar fascia connects heel to toes and supports the arch. Although called itis, it's really degenerative, more like fasciosis, from repetitive overload. The classic symptom is sharp, lancinating heel pain on the first steps of the day. In runners, the fascia is loaded at 2 to 3 times body weight, thousands of times per run. When load outpaces repair, you get micro tearing and then chronic degeneration. Mileage spikes, worn shoes, tight calves, and foot type all feed in. Foot type is central. Pronated feet, low arches that collapse inward, overstretch the fascia and carry the highest risk. Neutral feet are baseline. Supinate, high arch feet are rigid and concentrates force on the heel. Identifying the type guides treatment. Two ends of the spectrum. Overpronation overlengthens the fascia and needs motion control. Oversupination leaves a rigid foot that can't absorb shock and needs cushioning. This is why one generic insole doesn't work for everyone. The good news: most cases resolve with conservative care. Relative rest, ice, and non-steroidal anti-inflammatory drugs like ibuprofen, daily calf and fascia stretching, rolling the arch, supportive shoes, night splints, and massage. Consistency over weeks is what works. If diligent home care hasn't worked after about 6 months, it's time to escalate. The latter. Custom orthotics first, then cortisone injection, then shockwave therapy, and PRP, platelet-rich plasma for stubborn cases. Let's go through each. First, custom orthotics. Prescription devices that correct the mechanics, controlling pronation or cushioning a high arch. They target the root cause. Second, cortisone gives fast relief for stubborn pain, but we limit repeats because of risks like fat pad atrophy and fascial rupture. Third, shockwave therapy uses acoustic pulses to restart healing in chronic tissue. Non-invasive, good evidence. Fourth, PRP injects concentrated platelets, which have growth factors, from the patient's own blood to regenerate the degenerated fascia. Both target the underlying problem, not just the pain. To sum up plantar fasciitis, it's a degenerative overload injury. Foot type guides the plan. Conservative care resolves most cases if you stay consistent. And we escalate stepwise through orthotics, cortisone, shockwave, and PRP. If heel pain persists, get a free biomechanical assessment at StrideSmartRun.com. Thanks for viewing this presentation. I'm Jeffrey Bruening, DPM, sports podiatrist, minimally invasive bunion surgeon, and I'm dedicated to your health and wanting you to continue to run fast. So that's the playbook on plantar fasciitis. What it is, why your foot type matters, and how to treat it from your living room all the way up to the clinic. If you're dealing with this right now, here's what I want you to take away. Most runners get better. Start with the basics. Stay consistent. That's the part people quit too early on. And give your body time to heal. If this helped, do me a favor and hit the subscribe so you don't miss out what's next. And if that heel pain just isn't budging, don't tough it out for months. Head to StrideSmartRun.com where you can learn more or reach out about getting a proper biomechanical assessment. Take care of those feet, keep striding smart, and I'll see you in the next one.